4-year-old Noah Martinez was quietly coloring at his preschool table when his blood sugar levels began dropping to dangerously low ranges that could trigger diabetic seizures or unconsciousness within minutes if left untreated. His type 1 diabetes required constant monitoring, but young children often couldn't recognize or communicate the early warning signs of hypoglycemic episodes that could become life-threatening without immediate intervention. The busy preschool environment meant that subtle changes in Noah's behavior might go unnoticed by teachers who were supervising 15 other children during afternoon activity time. But Buddy, a golden retriever trained as a medical alert dog specifically for diabetic emergencies, detected the chemical changes in Noah's scent that indicated his glucose levels were dropping into dangerous territory. Within seconds of detecting the emergency, Buddy activated his alert protocols and began the systematic communication process that would bring help to Noah before his blood sugar could drop low enough to cause seizures, coma, or death from severe hypoglycemia that claimed young diabetic lives when medical intervention arrived too late. Welcome to Saved by Tales. Before we dive into this critical story of medical detection meeting life-threatening emergency and a therapy dog's specialized training, creating hope when diabetes threatened to claim a young life in the most routine of settings, join our community of animal hero enthusiasts who understand that some of our most sophisticated medical equipment walks on 4 paws and never takes a break from monitoring the children whose lives depend on constant vigilance. Sunny Days Preschool had been specially selected by the Martinez family because of their experience with diabetic children and their willingness to accommodate Buddy, Noah's specially trained medical alert dog, who provided 24-hour monitoring for dangerous blood sugar fluctuations. Noah's diabetes doesn't follow a predictable schedule, explained his mother, Carmen Martinez. Even with careful meal planning and insulin management, his blood sugar can change rapidly without warning, especially during growth spurts or when he's fighting off infections. Buddy, a 3-year-old golden retriever, had completed 2 years of intensive medical alert training that prepared him to detect blood sugar changes through scent markers that Noah's body released during hyperglycemic and hypoglycemic episodes. Buddy isn't just Noah's companion, noted preschool director Lisa Chen. He's a piece of specialized medical equipment that can detect problems faster than any technology we have available, and he never leaves Noah's side during school hours. The Golden Retriever's training included specific protocols for alerting school staff to medical emergencies, providing physical intervention to keep Noah conscious during episodes, and retrieving emergency supplies when immediate treatment was required. Noah's hypoglycemic episode began gradually during afternoon coloring time, with blood sugar levels dropping below safe ranges, while he remained focused on his artwork and showed no obvious signs of distress that might alert his teachers. "Pretty picture, Noah," commented teacher Sarah Walsh as she supervised the art activity, unaware that Noah's glucose levels were falling into territory that could cause unconsciousness within 15 minutes without treatment. Buddy's detection of Noah's changing body chemistry was immediate and precise, using olfactory capabilities that could identify diabetic emergencies before symptoms became visible to human observers. The Golden Retriever's initial response was subtle positioning closer to Noah, while he assessed the severity of the blood sugar drop and determined the appropriate level of alert response required for the situation. Noah continued coloring peacefully, his young mind unaware that his body was entering a medical crisis that required immediate intervention to prevent seizures or diabetic coma. Buddy's medical alert training activated as Noah's blood sugar continued dropping, beginning with gentle nudging designed to encourage Noah to consume glucose tablets that were kept in his emergency supply kit. "Buddy wants attention," Noah said softly, as the Golden Retriever pressed against his leg with increasing urgency, trying to communicate that medical intervention was needed immediately. When gentle intervention didn't prompt Noah to seek help or consume emergency glucose, Buddy escalated to the next level of his alert protocol, beginning systematic alerts to school staff who were trained to recognize his diabetes emergency signals. "Buddy's acting strange," observed teacher Sarah Walsh, as the Golden Retriever began the specific barking pattern that indicated diabetic emergency and required immediate adult response. The trained alert sequence was designed to bring medical help to Noah's location while providing physical support that could help maintain his consciousness if blood sugar levels continued falling toward life-threatening ranges. Sarah Walsh immediately recognized Buddy's diabetic alert barking and activated the school's medical emergency protocols, understanding that the golden retriever's behavior indicated Noah needed immediate blood sugar testing and possible emergency treatment. Medical alert for Noah Martinez. Sarah radioed to the school nurse's office as she approached Noah's table, where Buddy was maintaining protective positioning beside the boy. School nurse Jennifer Kim arrived within seconds, carrying Noah's blood glucose meter and emergency supplies that were always kept ready for diabetic episodes that could develop rapidly in young children. "Noah, we need to check your blood sugar," Jennifer said gently as she prepared the testing equipment, while Buddy continued his alert behavior to confirm that medical intervention was needed. The blood glucose reading confirmed Buddy's detection with numbers showing 58 mg/cl, well below safe levels, and dropping rapidly toward ranges that could cause seizures or unconsciousness in young diabetic children. Jennifer Kim immediately administered fast-acting glucose gel, while Buddy positioned himself to provide physical support that could help Noah remain conscious during treatment for severe hypoglycemia. "Good boy, Buddy," Noah said weakly, as the golden retriever pressed against him, providing the deep pressure therapy that could help maintain stability during blood sugar recovery. The glucose treatment began working within minutes, but Buddy maintained his protective position throughout Noah's recovery, monitoring his sense signatures for signs of continued improvement or potential complications. "Buddy saved Noah's life," Jennifer observed as she continued monitoring Noah's vital signs and blood glucose levels. "Without his alert, this could have progressed to unconsciousness or seizures before we realized there was a problem." Noah's parents were immediately contacted, while Buddy provided continued monitoring and emotional support during the medical episode that demonstrated the critical importance of his specialized training. Noah's blood sugar levels gradually returned to safe ranges over the next 30 minutes, with Buddy providing constant monitoring and comfort throughout the recovery process that confirmed the golden retriever's life-saving intervention. "I feel better now," Noah said as his glucose levels stabilized and his cognitive function returned to normal baseline levels. "Buddy helped me when I felt funny." The episode highlighted the ongoing challenges of managing type 1 diabetes in young children who couldn't always recognize or communicate dangerous symptoms before medical intervention became critical. "Buddy's detection gave us at least a 10-minute head start on this episode," Jennifer explained to Noah's parents. "That early warning made the difference between simple treatment and a potential emergency room situation." Buddy's behavior gradually returned to normal as Noah's condition stabilized, but the golden retriever maintained closer than usual positioning for the remainder of the school day. Carmen and David Martinez arrived at the school to find Noah stable and in good spirits, with profound gratitude toward Buddy and the school staff who had responded so quickly to the medical emergency. "Buddy is Noah's guardian angel," Carmen said as she hugged both her son and the golden retriever who had detected his crisis. "This dog monitors Noah's health better than any machine we could buy." The incident reinforced the family's confidence in their decision to use a medical alert dog for Noah's diabetes management, demonstrating capabilities that complemented technological monitoring without replacing the need for human medical expertise. "Buddy and the school nurse work as a team," David observed. "The dog provides early warning and support, while Jennifer provides the medical knowledge needed for proper treatment." Noah's medical episode became a teaching moment for other families and school staff who gained deeper understanding of both pediatric diabetes management and the remarkable capabilities of medical alert dogs. Buddy's intervention shows us how medical alert dogs can serve as early warning systems for children with chronic conditions, explained pediatric endocrinologist Dr. Robert Kim during a follow-up consultation. The case was featured in medical alert dog training programs and diabetes education materials, highlighting the potential for specially trained animals to enhance safety for children with medical conditions requiring constant monitoring. Following the preschool emergency, Buddy's protective behavior toward Noah became even more pronounced, with enhanced attention to subtle changes that might indicate developing blood sugar problems. The golden retriever's successful intervention increased confidence among school staff and other families, demonstrating how medical alert dogs could provide additional safety layers for children with serious medical conditions. Years later, Noah and Buddy continued their medical partnership through elementary school and beyond, with their story inspiring other families to consider medical alert dogs for pediatric diabetes management. Buddy had proven that some medical monitoring systems came with 4 legs, specialized training, and the kind of dedication that would never miss a dangerous blood sugar change when a child's life depended on constant vigilance and immediate response. I still think about that preschool afternoon, when a 4-year-old boy was quietly coloring while his blood sugar dropped toward levels that could cause seizures or coma, and his teachers had no idea their student was minutes away from a medical crisis that could have ended tragically in the most routine of educational settings. If Buddy had missed the subtle chemical changes that indicated Noah's glucose emergency, if he'd lacked the specialized training to alert school staff effectively, if he'd been anything less than a medical professional who understood that diabetes never takes breaks from threatening young lives, Noah Martinez might have collapsed at his coloring table while help remained unaware that intervention was desperately needed. Buddy's story teaches us something profound about the sophisticated medical partnerships that can develop between specially trained animals and children whose health conditions require monitoring that exceeds human capabilities. This dog didn't just detect a problem, he executed complex medical alert protocols that brought professional help to Noah before symptoms became visible to human observers, proving that some of our most reliable medical equipment walks on 4 paws and never stops working to protect those who need constant vigilance.